Hello there, I'm Dr. Brian McKay of Neuropathy CoreHealth. And what exactly is Neuropathy CoreHealth? Well, the program we have is a program to eliminate the pain from peripheral neuropathy or the numbness or the tingling. It happens to people primarily who have chemotherapy and diabetics. Now, it can also happen to other people with what's called idiopathic peripheral neuropathy. This means we just don't know where it came from, but a lot of times it's due to exposure from different. If you're exposed to certain toxins, like if you were a veteran, exposed to Agent Orange, you could have neuropathy. So it's a fairly common, but it's usually a secondary type of a presentation. So we call it like a comorbidity. So if you have diabetes or you have cancer, well, unfortunately, the sequela is typically you're going to develop one of these things, in some cases, not all, thank God, because we really don't want to see people suffering. But one of the problems with peripheral neuropathy is that once people get it, they become inactive. And the inactivity leads to less blood flow. Less blood flow makes the neuropathy worse. Now, I guess to get an idea what neuropathy is like is that, well, how it occurs. Okay, you have the nerve. So you have the nerve that goes all the way from your big toe all the way up to your brain. There is a wire that goes that long. I mean, very small in some areas, big in others. And the covering on the nerves we call myelin. And the myelin sheath allows for fast transmission of the nerve impulses. So the feet get it pretty bad because the feet have motor and sensory innervation. So your brain needs to know where those feet are as far as balance. It plays a big role in the vestibular system where the brain knows where that body part is at all times and tries to maintain balance. Now, when it's not getting the right feedback from the feet, and it can be the hands too, but let's for the feet, I see that primarily is the primary issue with peripheral neuropathy. So when it's not getting the input, brain sends another note. Hey, listen, another request. We want information, but we're doing this on a constant basis. So when it's not getting it and it's not getting it fast enough, the brain starts looking for that input, not getting it, which further raises alarms and starts the pain process. So what will happen in the case of a diabetic is there's too much sugar in the blood, and the sugar will eat away at the covering on the nerve, allowing for this slower transmission, which leads to pain, numbness, tingling, all the other stuff. And in the sense of a chemo patient, the chemotherapy is a toxin, and the toxin will eat away the covering on the nerve as well. So it's pretty devastating if you have it. What we found is that the medications are typically they're off-label use anti-seizure medications. You have gabapentin, Lyrica, Cymbalta, and these come with a whole host of other side effects. You got dizziness, weight gain, lethargy, brain fog, dry mouth, and you're already not feeling good because you've had chemotherapy. You're already not feeling good because you have diabetes. So now it's made even worse. And again, we sit down, we stop moving. If you move, you're unsure of your feet, and it becomes a slow, steady progression downward, not upward. So what we started to do is we started to figure out ways to treat neuropathy. And the way we treat neuropathy is actually it's several different ways we treat it. One way that we have this really wonderful machine from Germany called the Matrix Hacomed. Hacomed's the manufacturer. And these days, a lot of technology comes from countries that aren't as that rely less on medications. And so what we're able to do is create an environment that allows the nerve to regenerate that myelin sheath using this. Now, that's one particular treatment. So we have the Matrix machine, that's a whole nother podcast, really a whole nother podcast to explain that. So that's one particular thing. So we have the Matrix. Another thing we found that really benefits people is infrared light therapy, localized light infrared therapy, which is primarily done at home, and our patients will do that sometimes twice a day. And what the infrared light therapy does, it stimulates production of nitric oxide. Now, nitric oxide, everybody knows about it from that's the action of Viagra and Cialis and whatever the other one is. And what happens? It allows for opening up the blood vessels. So you get vasodilation. So the infrared light therapy is a painless type of a treatment. You put this light boot on, and you leave it there, and it stimulates production of nitric oxide, NO2, and that opens up the blood vessel. So as you open up a blood vessel, you get more blood flow. So it really does make a lot of sense. But again, this treatment is not something that is going to stop all by itself. I mean, because it's not going to get. I'm sorry, it's not going to get the promotion from a drug company. They want this pill, and you're going to be on this pill forever. The pills, your liver can only process so much in a day. So if you're taking, chemotherapy medication, diabetes medication, or other medications, chances are the population is going to be a lot older for neuropathy. So if you're on a blood pressure pill, a cholesterol statin, your diabetes medication or your chemotherapy medication, there's only so much your body can process, and it really kind of makes the liver become dysfunctional because it's got to prioritize. And sometimes these medications counter effect each other. So the infrared light therapy is a real good tool to have. It's very passive. You can be doing it at home because, let's face it, most of these people are sitting down way too much, and because they're inactive. So we can start getting better blood flow to that area on a localized level. I mean, you take a pill, it's going to work throughout the whole body. It doesn't go right to the spot. So we're able to affect a change on that level where it is. So if your feet are numb, you put the light boot on the feet. If your hands are numb, you put it on the hands. So we're pretty excited about that, I have to tell you, because we've seen great results using this now. But it's more the combination of different things that we use. So besides the infrared, what we found is whole body vibration. Whole body vibration is a tool that, again, stimulates blood flow. It's basically, if you want to sum it up real quickly, it's a machine you stand on, and it shakes the bejesus out of you. And what that does is your body's getting exercise passively, but it's also stimulating blood flow on a global level. The infrared light therapy is going to stimulate nitric oxide production. Now, if you do the whole body vibration, in addition, you're going to get much more blood flow because muscles will be involved. The muscles actually do exercise. Crazy story is the whole body vibration really got started with the Russian space program. They would send, you're going up, these cosmonauts are up there for a year, they lose muscle mass. So what they found is that by using whole body vibration, they wouldn't lose as much muscle mass and get passive exercise using limited amount of space. You can't send, you really can't send up a whole bunch of weights to lift up and out of space. It wouldn't be as effective. So summing it up so far, we've got the matrix to get that nerve covering regrowing. We have infrared light therapy, whole body vibration. Now, another thing we like to use is cold laser. Cold laser, best way to think about laser therapy is that laser is like photosynthesis for the cells, okay? Plants use light to grow. We actually have the ability to synthesize light and help to grow tissue as well. So it stimulates, tissue regrowth. So you have laser, and it's concentrated again. Apart from there's no real pain involved. But I guess the biggest thing is we have to understand the American diet is really not what it needs to be, and what will happen is the nutritional part is really big. The program I put people on is when we use a multivitamin called Catalin from a company called Standard Process. Now, one of the biggest problems I have always found with the supplement world is that there are so many different types of supplements out there, and you don't know where they're being made. I know for a fact I've been out to where the people from Standard Process have been in business since the 30s, and it was actually started by a dentist named Royal Lee back in the 30s. And the nutrition part is they grow all the stuff for the vitamins, and I've seen it, so it's not like hearsay. I've actually been out to their farms. It's out in Wisconsin. They grow everything organically. Any of the substance goes in is organic, and it's a food product. It's not a synthetic. You can go to Walgreens or CVS or Costco and buy vitamins. You don't know where they're being made. I know where these are being made, and the cost is not really that expensive, which is good because you want to have something you can stay on. So the Catalin is one of the best multivitamins on the market because it's made from organic food. So your body's not taking in synthetic, it's taking in food, recognizes it food, and it's better to assimilate. Now, the other thing with a particular with the B vitamins, anytime you have a nerve issue, you're really going to want to make sure that the B vitamins. It's you know also diabetics. I mean, people really deplete themselves of B, and the B vitamin is a product called Cataplex B. And Cataplex B contains thiamine, niacin, B6, but it also has a bunch of other nutrients you're not going to get. They call it proprietary blend. Say that 3 times fast on a Sunday morning. And in that proprietary blend, you've got vitamin C, you got manganese, you got phosphoric. You've got a lot of stuff in there that really makes a difference. But again, made from food products. When I went out to the farms, I was really amazed. I was really impressed to see them harvesting and then breaking. As soon as it gets harvested, the different products are juiced and dehydrated. So you're getting totally fresh, totally active ingredients into the supplement. There's a couple specific. Neurotrophin is another one. There's only really 4 supplements that we put people on, and Neuroplex to help rebuild the nerve and let that nerve function at a better part. You don't think about feeding a nerve, you just think about feeding your stomach, but the nerves need certain nutrients as well. So we have a fairly well-rounded program, but there's always ways to make it better. Another thing we've done is use a thing called PEMF, pulse electromagnetic frequency therapy, which charges the cells in the body. And I know it sounds like, oh, what's this PEMF? Well, PEMF, think about it. The more the cell membrane, when it's working properly, allows the cell to put out the garbage and to let the nutrients in. And that cell membrane permeability is a really key issue. When you have a proper charge on that cell wall, you allow for more efficient use of it's a more efficient transfer of the garbage out and the good stuff in. So the nutritional component is essential. As a matter of fact, if people come in here and they say they balk at the idea, we don't even bother taking them as a patient, because what are you going to do? You cannot possibly achieve what we want to achieve. So we have to raise the health, to bring the person to a healthier state. So by stimulating blood flow, using PEMF, cold laser, the matrix, infrared light therapy, we're really able to get people active. Now, there is a physical therapy component because you really got to get people moving. And that's one of the key things. It's like you have to stop that downward cycle. So that is basically, in a nutshell, what Neuropathy CoreHealth is. Fortunately, some of the care is covered by Medicare, which is a good thing. It really does make a difference. Not all the care, Medicare does not cover your supplements. There is a portion out of pocket, and we try to keep that as low as possible. So my suggestion is, why don't you come, if you have neuropathy, come in, because before we do anything, we try to educate you about neuropathy and try to get you out of that mindset, well, I'm going to take another pill, I'm going to take my Lyrica, my Cybalt, it says it works on TV. I got to tell you, for the most part, it doesn't work. It really makes things more difficult for the body to heal. But Neuropathy CoreHealth has been helping people. We're committed to bringing the cost down for treatment. There is some cost involved that's not covered by Medicare. But I invite you to come in. Come in, give us a call, 203-875-0846, 203-875-0846. And if you have questions, we're going to answer these questions. We're going to do an examination, determine how bad your neuropathy is. And as a matter of fact, we do this one test that if you don't pass, we can help you, which is a shame because we really try to help as many people as possible. But the idea here is we do help people. You got to want to get better. We've helped people post chemo kind of get their lives back. They have chemotherapy and they want to feel better, but they can't, because of all this stuff. It's rewarding in a sense. And as far as I know, we are the leading provider of neuropathy care in Fairfield County. So sure, there might be other people who say it. I think we have the results. We have the number of people to show that we've been able to help them. So again, Dr. Brian McKay, you want to come in? Come on in. I'm more than happy to help you. 203-875-0846. Have a great day, and we'll talk to you soon.